Hello everybody, good day mommies and daddies, grandpas and grandmas. This is Dr. Omobola Adetunmbi of Psych Wellness NG, an initiative to promote and create awareness about child and adolescent mental health. We also help parents nurture their children to ensure that they develop to become mentally balanced adults. So today I'll be talking to parents of children in the preteen and early adolescent age group. That is children between the ages of 10 and 14. And we'll be talking about ways we as parents can help our children not fall into the shackles of drug use and addiction. Drug use and addiction is a common thing in our environment today. And you agree with me that you know somebody, probably a neighbor, a friend, a niece, a nephew, or other people in our environment that are dealing with drug use and addiction. I know people personally and in my professional career as a child and adolescent mental health consultant who are dealing with drug use and addiction in their children. So we as parents, we need to be equipped with the knowledge and information that will help our children not fall prey to this problem. Now, scientific research has shown that most children with mental illnesses has their first episode before the age of 14. Likewise, substance use problems usually starts between these ages of 10 and 14. The first exposure to substance use is within this age group. So this age group is very critical and vital for us to prevent long-lasting drug use problems. So what do we do as parents to help our children not fall into this problem? The first thing is that we must know our children's friends. Not only that, know the activities they engage in when they're together and know where they hang out. A lot of parents, yes, know their friends, their children's friend. But when their children and their friends go out, do you have an idea of where they go? Do you have an idea of what they do in those places that they go? No child is born an addict, and no child is born to be bad. These bad habits and behavior are things they pick up in the environment. So we must go the extra mile in knowing our children's friend, have an idea of where they go. If possible, go there and just look at the environment. Is it a place where substance use is promoted freely even among underage children? You may say, my children go there, they don't do all those kind of stuff. They just go there to do some other things. But that environment is toxic enough to influence your child's behavior. So you must have an idea of where your children go to and screen the place to ensure that your children do not pick bad habits while they are there. There are a lot of public places where children could just normally go to have recreation, but a lot of drug use activity and other vices take place in such activities. Those are not the places to encourage our children to be. Also, as parents, we need to be honest about our own previous drug use. Some of us as parents might have used a substance or two in the past. It is better we are honest to our children about these experiences and let them know the impact these substances had on us while growing up, or in our relationships, or in our career, so that our children learn from us. There's no point hiding the truth and saying, no, I want to portray myself as the perfect parent, because at a point in time, the child will know, and then the damage could have been long done. Also, it is important that we keep prescription drugs like sleeping tablets, pain medications, and all of that away from reach of children. Most children have experimented with this kind of medication, and they've grown to use even other more addictive substances. So we must keep this medication away from our children. Also, for us, some of us that have open bars, this might be a time to review the need for those bars in our homes. I know a lot of parents that have closed down the bars in their homes and turned them to bookshelves or libraries for their children. This might be something that we must all look into if this behavior would affect our children in one way or the other. Another very important thing is that in our homes, we must have rules, we must set rules, and there must be consequences for erring against these rules. There must be ground rules about time to come in, activities to do in the home, when to do it, and how to do it. And when our teenagers err, to these rules, there must be consequences. We must not just overlook these rules and say, oh, they are just children. Remember, teenagers are growing adults, and whatever things they're able to reinforce into their lives, these are the things they're going to grow up to become adults with. Also, another very important thing is we must limit the time our children spend watching cartoons or games or some other very reinforcing or addictive habits. Scientific research has shown that the same process of addiction of drug use is the same process of addiction of some of these games, gambling, and some of other activities that involves reinforcement, motivation, and reward. So we must limit our children's exposure to this kind of games, cartoons, and so on and so forth, because they have a long way in influencing addiction in our children if peradventure they experiment with one of these substances. Thank you very much for listening. I also want to thank everybody for the feedback of last week's video. At Psych Wellness NG, we are here to answer all your questions, to give clarifications to the issues you might have in nurturing your children, and also to increase awareness about child and adolescent mental health in this environment. Thank you very much. See you next week.